Good afternoon, everyone. Let me introduce myself. I'm Howard Lamplugh, and I am the Employee Benefits Consultant and Broker for your health insurance coverages, your dental, your short-term disability, and your group life. I've been doing this job for Criswell now for a little over 20 years, and if I look familiar to some of you in the audience, it's only because we've seen each other many times. This year, we're going to be discussing the open enrollment benefit material, as we always do. And as we go through this, I think you're going to find that there have been few changes, not many. The pricing is great this year. And one of the things that's important, most important, and I'm going to repeat it several times here today, is that enrollment this year is going to be through the Criswell ADP portal, your payroll portal. That means that you will not be enrolling on a paper form this year. We've discontinued that. And as a result, you're going to have to sign on to the payroll portal and complete electronically your enrollment for the open enrollment program for all of the benefits, whether it's medical, dental, short-term disability, life insurance. All of these items will have to be done electronically on your payroll portal. It should come up automatically, I'm told. I'm not the expert in IT, but it'll come up automatically when you go onto that portal. So, everyone is going to get an envelope that looks like this, and it's going to be sent to your home. That's another change we're doing this year. We're not distributing material work site. We're sending everything to your home. So you're going to get this envelope. It's going to have up in the top left-hand corner, it's going to have a label that says Important Criswell Automotive Employee Benefits Information. When you see that, don't toss it, keep it, take the contents out, and that's what we're going to be reviewing today, what was going to be in that envelope that you get at home. I would request that all of you that are married, please share this information with your spouse. It's one of the reasons why we're sending it home. Many of you have alternative benefits from another employer that your spouse may have where they work. And it's very worthwhile to make the comparison, determine which is the best deal for your family. So this information would be important for all of us to review with our spouse if we have alternative benefit options. So taking the information out of the packet, there are several items. I'm going to go over them one at a time. And as we go through it, if you have questions, please feel free to ask. We can stop and discuss any individual circumstances, or after the meeting, we can also talk about your individual point if you'd like. Okay, getting started, there's a letter, cover letter. At the top of it, it says Criswell Automotive, Employee Benefits Plan Announcement and Instructions. And right underneath that, it says, please read completely. And I would ask all of you, please do that. It's important because there's a lot of important information in here. The first paragraph talks about the online enrollment. And that online enrollment, again, is something that you're going to have to do in order for this benefit plan to work for you. So as you read through this, it says, in very basic terms and things that we've covered so many times before, the plan is available to anyone who works 30 hours or more per week at Criswell. And these plans are available to all of us that work for Criswell on a 30-hour basis. There's dental, there's group life, there's short-term disability, and there's 3 different medical plans that you can choose from. When you start reviewing this information, I'm going to spend the most amount of time in this meeting reviewing the medical coverage. It isn't that I don't want to dismiss the other benefits, but we're not really having a great deal of detail with those plans to cover. And again, if you have questions, please feel free. First thing we're going to talk about in this package is the most important part that everybody always wants to know about. There's this neon orange, you can't miss this, the neon orange page which talks about the costs. And everyone always wants to know that first, so let's talk about it. On this page, you're going to find that there are medical rates for the high deductible plan. That's the first medical plan. Then there's two Kaiser medical plans, the Kaiser HMO, and separately the Kaiser Flex G plan. Now, I'm going to cover each one of those three medical plans in some detail. Below that on this form, we also have the rates for the dental coverage. Separately, we have the rates for the life and short-term disability at the bottom. And from an eligibility standpoint, these plans have not changed. Everyone's still free to join them. They are separate plans, and that means that you could join the medical plan or not join it. You could separately take the dental plan or not take it. They're independent. You can choose to join one or all of them, but they're all individual and separate items, and the cost details are shown in this neon orange page. Now, we show rates, meaning employee contributions, in two ways. There are biweekly rates, and then there are monthly rates. We recognize that some of you are paid monthly, some of you are paid biweekly, so we break those down for you. The other thing that's worthwhile for you to note here, and it is really worthwhile, the rates that we have on this page have gone up ever so slightly. And I say ever so slightly, it's between 1% and 3%, depending on which benefit we're addressing here. That's crucial for you to know because we work hard at trying to keep the health care coverage under control in terms of cost. Annually, we work on this, and I try to compare it, if I can, to what's going on nationally or even regionally. What you'll tend to find is that most plans, employer plans, are going up in terms of costs that are mid-teens to the lower 20%. Employees' shares, and that's the ones you'd be most interested to know, employee shares are typically going up about 5 to 6%. We're really pleased to be able to say to you that 1 to 3% is what's happening here. And to that end, I think it's an extraordinary event. We can't completely, totally hold the line, but it's really a worthwhile benefit to know that your healthcare costs or your dental costs have gone up very, very little. So I'm not going to belabor this orange form anymore, but the costs are there. You can look at that as you have the opportunity. And now I'm going to talk more about the medical plans because really the medical plan options are the meat and potatoes of the employee benefits program. Okay, so let's talk about the medical plans. Now, the first thing I want to talk about is the form that we have that describes very briefly the three medical plans. And those three plans are the high deductible plan, which is over on the far right-hand side. And in the middle is the Kaiser HMO plan. And then these three next columns combine together to describe the Kaiser Flex G plan. Now, this is a nice brief summary. It's not everything you would ever want to know about the health plan, but we do try to describe and compare based on this far left-hand side benefits column. So we're able to describe and compare and contrast the three medical plans. I'm going to come back to this page a little later because I'm going to talk about the details of each plan more fully. We'll come back to this page in a little bit. But first, let's start with the first column there, which is the high deductible plan. Now, the high deductible plan, the high deductible health plan, is one where we don't have a great deal of participation in it. I think we should, and the reason why is because if you look at it in terms of your circumstances and your health, if you're reasonably healthy, this could be a very, very good plan for you and save you a significant amount of money. Essentially, in the neon green colored program here is, or pages here, are what describes the high deductible plan. But as you look at it, essentially, there is a $2,000 deductible up front per year that you have to satisfy before you get benefits. And after that, the plan pays 90% after you've satisfied your deductible. That goes until you have reached a maximum out-of-pocket of $5,000. These are for individuals. The family deductible is a maximum of 2 per family, which is $4,000, and the maximum out-of-pocket for the family is $10,000. What's worthwhile knowing is that attached to this high deductible medical plan is this pink sheet, a health savings account. Of the 3 options that we have, this is the only plan that has a health savings account. What's a health savings account? A health savings account is an account that you establish at your bank for yourself. You can put money into it on a pre-tax basis if you choose to. But if you are in Criswell's healthcare plan, the high deductible plan, Criswell will put in there $100 a month for you each and every month. All you have to do is open an HSA account, health savings account, at your bank and give us the number and we would deposit it into your account, $100 each month. This is particularly effective for younger single people who, as I call them, I used to be immortal. Now I'm 60. So the fact of the matter is, though, is that if I were still in my 30s, my late 20s, and I've been very healthy, I've been fortunate, I could have had a great amount of money in a health savings account if this had been available when I was that age. And over the years, I've had very, very few medical problems. The money would have accumulated in that account for me. As it is now, that's what I have. That's the product that I've chosen for myself and my family. And I would tell anyone, think of it this way. There's a $2,000 deductible up front, and I did say that. But if we give you $1,200, $100 a month, well then you've got $1,200 up front, and it's really not a $2,000 deductible anymore. It's actually, you've got $1,200 to spend, and you've got what I call a corridor, a risk corridor of $800 before you reach the $2,000 limit. And I hope everyone understands that. But the fact of the matter is that it's truly not a $1,200 deductible if I'm giving you $1,200 to use to satisfy it. And here's the great thing. If you don't have any medical problems, or if suppose you have one, suppose you get the flu at some point during the year and you have to go to the doctor and then you have to get a prescription and maybe you spend $300-400 of the $1,200. The rest of it is still in your account and it carries forward to the next year. It's yours. You own it. If you leave Criswell next year, 2 years, 10 years from now, if you leave Criswell, that money goes with you because you own that account. And I can't say enough good about these options for people where it will work. And where it will work are people who are relatively healthy, don't have chronic illnesses, and don't need medical service on a daily or I'll say weekly or monthly basis. As I said, I think that this is a great option for people where it works. And if it doesn't fit your circumstance, that's fine. We have 2 other healthcare plans that likely do because they're more traditional healthcare plans. And I'm going to put this down at this point and I'm going to launch into the 2 Kaiser plan options. So we have 2 Kaiser plans, and unfortunately, they look like this. And if you look at these carefully, they look the same, but they're different plans. So I'm going to cover the HMO plan first. Now, in order for us to differentiate these in your envelopes, we put a little yellow line where it says HMO in the middle, right at the top. And separately, we put a little pink line right there where it says Flex G. And that's about the easiest way you can distinguish and differentiate the 2 Kaiser healthcare plans, but they are dramatically different from one another. So let's talk about the HMO plan first. This material that I'm holding up, it's an 8-page format. It's the federally mandated guideline for summary benefit provisions that we have to provide to people. The best thing I can tell you about this is that I'm going to summarize the details. And Kaiser's healthcare plan is I'll call it your typical HMO. It means that you have to utilize Kaiser's network in order to get benefits, unless there is an emergency and you're out of the area. Otherwise, if you're in their region, around the Washington, D.C., Baltimore area, you have to use their network. They have a tremendous network here, particularly right outside of Gaithersburg here. They have a giant facility that will basically provide virtually every service that you would need. And frankly, I've heard nothing but good about Kaiser's healthcare plan. So we implemented this about 4 or 5 years ago. It's worked very well. It's a traditional plan in that when you look it over, and I'm going to flip back to page 2 and I'm going to go down some of these benefits with you. If you look it over, you'll find that if you need to go to a doctor, it's a $25 copay. If you need to go to a specialist, it's a $35 copay. If you need to have a blood test or an x-ray, there's no charge. If you need a more exotic diagnostic test like an MRI or a CAT scan, it's a $75 copay for that test. The prescription drug benefit, it's a $15 prescription drug benefit for generic drugs. It's $25 for preferred brands, and it's $40 for non-preferred brands. Again, by the way, these are very common and typical copay-related healthcare expenses that you would find in many, many healthcare plans, whether it was Kaiser or some other carrier. Second page, outpatient surgery is a $50 copay. If you need to go to the emergency room, and I would suggest to you try to avoid the emergency room if you can. Urgent care center or your primary care doc is a better choice, but an emergency room is a $100 copay. If you need to be in a hospital, inpatient, it's a $300 copay for each hospital admission. And I'm not going to belabor this and go on and on and on because there are more pages, but this healthcare plan requires you to pick a primary care physician. Your primary care physician will manage your health insurance. They will refer you to specialists if necessary. If it's absolutely necessary, they will refer you outside the Kaiser network. You don't see that very often, but that does happen from time to time. But this benefit plan is an extraordinarily good plan compared to what you see out in the market these days. It's because there's no front-end deductible. And that's becoming rare. Most plans have a front-end deductible of some kind before you get benefits. This plan does not. And as a result, it's there for you to review, take advantage of. It's the plan that the vast majority of people in Criswell's healthcare program are implemented or enrolled in. And to that end, I would say to anyone, if you want to talk more about it, I'll be happy to help you with it. But the best salesman we've got of this plan is Scott Blatchley. And Scott will tell you it's a great plan. But if you have questions about the HMO plan, please feel free to give me a shout after the meeting, and we'll be glad to go over it. Now, I'm going to move on to the other Kaiser healthcare plan. It's the one with the pink line. This is called the Flex G plan. Now, the Flex G plan, if you were to refer back to our cost page, I'll use the orange one. If you were referring back to this orange cost page, you'll find that the costs for the Kaiser Flex G plan is much more expensive than the other two options, either the high deductible plan or the Kaiser HMO. And that is because this Flex G plan from Kaiser gives you the benefits of the HMO as a start. And then on top of that, it also gives you 2 more layers of additional benefits where you can go outside the Kaiser HMO network. And you can go to what's called the PHCS program or the PHCS network, or separately to any licensed provider. The benefits are lower than the HMO, but you have that option at any point in time that you're provided service whenever you may need it. So today, you might go to the HMO for, let's just say, a cold or the flu. But then you find out you need more serious specialty care. And you could choose to go to the PHCS network, which is a very wide national network, or you could choose to go outside the PHCS network to any licensed physician. The benefits of the PHCS plan have a front-end deductible of $300, and then it pays 80%. The out-of-network, meaning any doctor that's not in PHCS or in Kaiser, has a $600 deductible, and it pays 60%. But you still have that option. In order to get those options in the Kaiser Healthcare product, the Flex G, you have to pay more to get that. We don't have very many people that are in it, but for those people that feel the need to have that additional care, that additional option, it's available. So for that end, I would suggest to you that if you're using this 8-page format that Kaiser provides, that you will recognize or see, after you flip past the first page, you're going to see columns. And those columns will say what you pay if you're using the Kaiser network, what you're going to pay if you're using the PHCS network, and what you're going to pay if you use any doctor that's available, that's licensed. I like, rather than using Kaiser's 8-page format for the Flex G, I really like using this page. And that's why I told you before, we're going to refer back to this page. This page gives you a nice, neat, single-page format where you've got the high deductible plan in the, I'll call it the purple, and you've got the Kaiser HMO, which is here in the middle, and then these 3 columns on the far right of the page when you look at it is the Flex G, and it has the same HMO benefits as this one, but all put together in this comprehensive plan. You've got the PHCS benefits and then the non-network benefits. And we compare the benefits, item by item as we go across the page. Now, I'm not going to try to read all of that to you, but what's important that you recognize about this option from Kaiser is that A, it costs more, and B, it gives you the most amount of alternatives that anyone could ask for in terms of receiving care. One other thing that's worthwhile noting on this single page, down here at the bottom, as you go across the bottom, we also put the costs of each of the medical plans so that you've got the self-funded plan or the high deductible plan. And separately, you've got the Kaiser HMO plan, and then we've got the Flex G. You can compare and contrast benefits as well as costs right here on a single page. I like this page a great deal because it really simplifies the whole spread of these, these multiple lines into one place. If anybody has questions about this single page or any of the plans, be they the high deductible plan, the Kaiser HMO, or the Kaiser Flex G plan, again, ask now or stop me after the meeting. I'll be around for several hours here, remaining the rest of the day, and we're also going to have meetings. So go back to this white page. We have meetings scheduled for the entire week of starting September 12th, which is a Tuesday, 12th, 13th, 14th, and 15th. I will be bouncing back between Honda and Chevrolet up in Gaithersburg. There's one day there for Thermont, by the way. But I'll be back and forth doing these employee benefit meetings just like this and reviewing this material and giving anybody and everybody the opportunity to ask personal questions independently, individually, or in a group setting. And I would also recognize to people, don't be afraid to ask that question, because your question may very well be the same question someone else in the audience has, and it may be the best way for us to all learn more about the coverages. So with that, we're finished with the medical. Take a break for a second, and I'm going to reach for some other paper here, and we're going to start out then on the short-term disability and the dental. If you are not in the medical plan now, if you're not in any medical plan, and this material is not in your envelope, if you need to enroll new into a medical plan, whether it's the high deductible plan or the Kaiser plan, that material is something you're going to have to get from Scott Blatchley. There is a separate enrollment form that may be needed by Kaiser or GBS, who handles the high deductible plan. I want to make note of that to you because, again, it's not in your envelopes, and it is it's a paperwork requirement. That's the only way I know how to address it. So I don't want to forget, having said that, as a part of the medical. Now we will go on to dental and short-term disability. Okay, dental. Dental insurance is outlined on this light yellow page. At the top of it, it says, Criswell Automotive, Schedule of Dental Benefits, effective October 2017. And the dental benefit plan has not changed. It's the same dental benefit plan we've had for the past several years. You can go to any dentist that you want to. So that's not an issue. There's no specific network of dentists. The dental plan itself breaks your dental services down into three areas. They would be preventive and diagnostic, and restorative, and major restorations, and finally orthodontia, but the orthodontia is for children only, so I'm going to kind of put orthodontia over on the side. Under the preventive and diagnostic benefits, plan pays 100%, and this is after, well, I'm not going to use the deductible yet, so it pays 100% for preventive and diagnostic benefits. Now, when you get to what they call Class B benefits, which is the restorative benefits, this would be things like fillings or root canals, periodontal work. Those Part B benefits have a $50 deductible. This is a one-time deductible annually, and that $50 deductible applies to a single. It's 2 per family. The deductible only applies to the B and C benefits. So if you're having a restoration or if you're having a major service provided, you'd have the deductible first. Now, back to the restorations. They're paid at 80%. And if you go back here into the material, the details on page 2, actually I should have done this for Class A as well. There's Class A benefits that are the preventive and diagnostic services, and then down here there's a long list from 1 to 12D that talks about restorations or restorative benefits. They're the 80% benefits. Going back to the front here, the next class is major restorations. They're paid at 50%. And the 50% benefits are essentially bridges, crowns, and dentures. Those are the 3 of the most common things that you're going to find. It's essentially replacing something that was previously there, where there's a hole now. If you look back on page 3, the major services are noted right here at the top, and pretty much says dentures, bridges, repair and re-cementing of crowns, and one thing that's relatively new, dental implants. So dental implants are also covered by the plan. That's another thing that previously we didn't have that a few years ago. Dentists are doing more dental implants these days as opposed to doing crowns and bridges, so dental implants are covered under the plan. Now, overall, it's worthwhile noting, because this is a good benefit, the plan pays up to $2,000 of benefits per year. And To that end, I would tell you that a lot of other plans are maybe not as generous. A lot of plans are $1,000. There are many that are $1,500. We have a $2,000 benefit. It's for the combined A, B, and C, or preventive diagnostic, restorative, and major restorations. So those combined, you get a max of $2,000 per person. So if you have a family of, say, 3 or 4, each person gets a $2,000 dental benefit. It's not a family benefit, it's $2,000 per person. Now, separately, there's an orthodontia benefit. It is singularly only for children. It's not for adults. And it's a $1,000 one-time benefit. You only get it one time. Many of you will say, well, orthodontia, that's usually a $6,000 or $7,000 or $8,000 event. I have 2 daughters. I absolutely agree with you. And it's a $1,000 benefit. That's the only thing I can say about it. Maybe someday dental insurance industry will start increasing the ortho, but the fact is that it's a $1,000 benefit. If your child needs braces, it's $1,000 you won't have to spend, but I don't know anybody that's going to do the job for $1,000. But that said, it's still worthwhile to know that you've got that ortho benefit available for children if you have kids in your dental plan. Now, without reading all of these in detail, I want to point out the fact that on page 3, there are general exclusions to the dental plan. I'm not going to cover them in detail. Please take a look at those, but they are common, very common to dental plans. Those exclusions keep on going on to the back of page 4. So be aware that there are some exclusions, but our dental plan here at Criswell is an excellent dental plan. Many people take advantage of it, use it. We expect you to use it, and it will serve you very well if you join it. It's an independent benefit. You don't have to be in the medical plan in order to use the dental. You can just join the dental plan if you want. The costs for the dental plan are on neon orange here, and that dental coverage cost is for single and or single plus one or families. So if you have one dependent, you and a spouse, or you and one child, the single plus one would apply. If you have full family, it's a little bit higher rate, but the rates for the single plus one and the family are there. And you will notice that those rates have not gone up this year. So they've stayed the same. That's all I have on dental right now. If there's questions about dental, feel free. But it's a great dental plan, and it's worked very well for us here for the past 15 years. Now, last thing. This blue sheet addresses short-term disability. Short-term disability is a benefit that you can purchase. It's not very expensive, and it is an item that allows you to collect 50% of your pay up to a maximum of $500 if you're out on disability, and it pays after you've been out for 2 weeks. So the first 2 weeks are on you. After that, you would get 50% of your salary up to a max of $500, and that benefit would be paid to you for a period of 26 weeks. Now, the bottom line on that is that if you have an illness, I know it isn't going to replace your entire income, but the fact of the matter is that it's better than nothing. And many people have the coverage. We've paid benefits out for probably a half a dozen people with disabilities over the course of the past year. I hope no one really needs it. But the fact is that your paycheck's important. We don't cover all of it, but the short-term disability plan is useful. It's not expensive. Going back to our neon orange, the short-term disability costs are in the bottom right-hand corner down here. And you'll also find that these costs have not increased for the coming year either. So they're the same rates that everyone paid last year if you were in it already. It's an independent benefit, just like the dental. You can join this, you can let it go, don't use it, but it's your choice. And again, it's a voluntary benefit that you can pick up and participate in if you wish. One thing that's worth...
$500 per pay period or per week, or what is it?
It's $500 per week. Good question, thank you. I should have mentioned that. Yes, it's up to $500 per week, and it's 50% of your pay. So if you're not making $1,000 a week, it would be 50% of your pay up to $500 a week. Okay, is that clear?
Clear.
All righty. And that aside, one thing I want to mention, the plan has a pre-existing condition clause. And a lot of people ask me about that, and I'll make it as easy as I can. A pre-existing condition clause says, if you are taking a medication or being treated for an illness or an injury, whatever, in the 3-month period prior to joining the STD plan, summary, 3 months prior, that item, that illness or that injury will not be covered for the first 12 months of insurance. So, if I have a bad knee and I've been getting therapy for that knee, generally for the last, say, 6 months, and I join the short-term disability plan, and then sometime during the year my knee goes out and I have to have knee surgery or whatever happens to my knee, specifically the knee, I will not get benefits under the short-term disability plan because the knee disabled me and I was treated for that within the 3 months prior to becoming insured. Now, if I purchase the STD, short-term disability, if I purchase that and I don't become disabled by the knee in the first year and I stay insured in the second year and beyond, doesn't matter what happens with the knee, I'm still insured and they'll pay benefits. I hope that is clear to everyone. Now, go the other way and stick with my knee. If I've had problems with my knee, but I never got any help for it, I've just been kind of limping around and ignoring it or living with it, and I never went to the doctor, and I never took any medication for it, and I joined the short-term disability plan, and then 2 months, 3 months, 4 months, in the first year, my knee finally goes and gives out on me, and I have to have knee surgery, and I'm laid up, and I can't work for a month or 6 weeks or whatever. The short-term disability plan will pay me because I didn't have a pre-existing condition based on how they define it. I wasn't treated, and I didn't take any medication for it. So that's important for you to recognize the distinction for a pre-existing condition. It's not all the time totally clear to everyone what that pre-existing condition clause says, but it's basically if you're treated or have the condition and took meds for it 3 months prior, then it's not covered for 12 months. It's just that item, that condition. If my trick knee isn't what gets me, and instead I fall down a flight of steps and I break my hip, I'm covered. If I get some kind of medical disease or some kind of problem that just came out of the blue, I'm covered. The pre-existing condition clause applies to the item or the circumstance, the illness, the injury that was treated immediately prior to joining. Hope that that's clear for everybody. If not, see me after and I'll be glad to explain in more detail. Okay, folks, before we finish, a couple of housekeeping items and one last thing I want to talk about. Group life insurance. There is a reference on your orange sheets in the bottom left corner for life insurance. And You won't find any descriptive material in here. The group life insurance plan that we have at Criswell basically provides all employees a $20,000 benefit. You name the beneficiary. If you're in management, it's a $50,000 life insurance benefit. The thing that's worthwhile that you should know is that down here it tells you the cost of that benefit. If you want to join it, it's $2 biweekly, or it's $4.33 a month. It's well worth joining that if you want to. Many of you are in it. If you want to remain in it, that's great. If you do not want to join it, that's fine too. It's an independent benefit like all the other ones. I mention it because if you're going to join the plan, you're going to have to touch base with Scott Blatchley about those forms, because we are changing insurance carriers from AIG to AXA. And that's happening as of October 1st. And I do not have the forms to put into this package. So we're waiting for AXA to tell us, relative to the transition from AIG to AXA, how we're going to handle that. For those of you that are insured, it'll be automatic. You won't have to do anything. It'll just be an automatic takeover. If anyone wants to join new, who's not in the life insurance, you can do so, but in order to do so, you're going to have to touch base with Scott Blatchley. Now, that's the wrap up on the benefits. A couple of things that we need to talk about going back to the portal. As we said, wherever that is, there it is, on your letter, you folks need to go onto your ADP payroll portal in order to enroll. And if you're not going to enroll, you also have to go on there to decline. Whether or not you're aware of it, believe me, I deal with this every day, and it's not something I necessarily want to deal with. But the federal government in the Affordable Care Act says very distinctly that employers have to have a record of enrollment and declination, and it's part of the Health Care Act. So we've got to have you go on and say either I'm enrolling or I'm declining, but you have to go on. The drop dead date for that is September 22nd. Please, please, please don't wait until September 22nd. Get on this now. Go on. I didn't design it, but from what I understand, it's easy and you can't miss it. So check out the benefits. Talk to your spouse if he or she has coverage available. Compare and contrast. And if anybody wants to call me, I'll be happy to volunteer to allow you to give me what your spouse benefits are and compare and contrast it for you. I'll do that. But at the end of the day, you have to go on the portal. You have to accept or decline each of the benefits. And we have to have a record of it. And we'd rather not have to track you down for it, because we will have to if you don't do it. Short of that, if you have any questions, please feel free to contact me. And as I said, I'll be here the whole week of September 12th through the 15th. And you can reach me either through, if I'm not here, you can reach me through Scott Blatchley or Barb Menso. And otherwise, thank you for your participation, and your audience today was wonderful.